اوكي، نتكلم عن ال ABG interpretation. ال ABG interpretation it's really very important skill، خاصة للنيرسينج student، medical practitioner أو critical care nurses in general. فال ABG يعني إيه كلمة ABG؟ أولا ال ABG هي عبارة عن laboratory test used to assess or to monitor patient acid base imbalance. اوكي، هنمسك ال ABG step by step how to interpret the ABG using a very simple method. We call it tic-tac-toe. Tic-tac-toe, it's really simple method to interpret the ABG. First, we need to know what are the components of ABG. Components of ABG، احنا بنبص على ايه في ال ABG لما نيجي نعمل ABG interpretation؟ عندنا 3 حاجات اساسيين، ما ينفعش اقرا ال ABG من غير ال3 حاجات دول. ايه هما؟ عندنا ال pH، ال PeCO2 وال HCO3. نمسكهم واحدة واحدة. ال pH، ايه هي ال pH؟ ال pH ديت اللي هي بتميجر الهيدروجين ايونز concentration. الهيدروجين لما بيزيد بيحصل ان ال pH بتقل، والعكس صحيح. If pH is increasing, hydrogen ions will decrease. Okay, so pH is measuring if the patient is acidic, or alkalotic. Okay, acidic or alkalotic. Okay, what is the normal pH? Normal pH من 7.35 to 7.45. Okay, 7.35 to 7.45. Below 7.35 is acid doses. Above 7.45 is alkalosis. Okay, we'll go for the next component of ABG. The next component of ABG is the PeCO2. What is PeCO2? This is a partial pressure of CO2, partial pressure of carbon dioxide. يعني ايه partial pressure of carbon dioxide؟ partial pressure of carbon dioxide دي بتميجر الجاز exchange. اوكي، الجاز exchange CO2 او ventilation process. So it's related to respiratory buffering system. What are the normal PeCO2? The normal PeCO2 is 35 to 45. So if the patient is having high PeCO2, what will happen? The PeCO2 will combine with hydrogen in the blood and forming what we call it H2CO3. What is H2CO3? H2CO3 is carbonic acid. That means if you have higher levels of PeCO2, your blood will be acidic. Okay, your blood will be acidic. If you have low levels of PeCO2, so your blood is going to alkalotic side. Okay, we'll come to the third part of ABG. What we call it? The bicarbonate. What? Bicarbonate, HCO3. HCO3, call it bicarbonate. It is the buffering system of the kidneys. Bicarbonate is a buffering system of the kidneys. What is a normal bicarbonate? From 22 to 26. Okay, now we'll come to ABG interpretation back again. If you want to interpret the ABG, first we need to know to answer 3 questions. First, is the patient having acidosis or alkalosis? Number 2, is it respiratory or metabolic? The third question is it compensating or not compensating? Okay, these 3 questions keep in your mind: acidosis or alkalosis, respiratory or metabolic, compensatory or not compensatory. How you know this? Just remember the normal ranges of these components. Okay, then I will give you an example and I will tell you how to interpret the ABG. For example, if you have pH of 7.23 and BeCO2 of 50 and you have bicarbonate 30. Okay, so now we'll go to first step. Just make your tic-tac-toe grid. You will make your grid. What is this tic-tac-toe grid? It's like that. Okay, here is acidic, here is alkalotic, and in the middle is the normal levels. So what is the pH? We said pH is 7.23. 7.23 will comes under acidotic or normal or alkalotic, so it will come under acidotic. We'll write here the pH. So we'll go for next point. BaCO2 is 50. Is it acidotic, normal or alkalotic? Higher BaCO2 means acidotic, because we said BaCO2 is more in the blood. It will join or combine with hydrogen and form carbonic acid, H2CO3. So more BaCO2 means more acidic. So BaCO2 here, right here, BaCO2. Okay, so bicarbonate is 30, so it will come under alkalotic or acidotic. Bicarbonate 30, it will come under alkalotic. So write it here, HCO3. Now we want to answer the first question. Is the patient having acidosis or alkalosis? pH in the acidotic side. So now we answer the first question is patient is having acidosis. Second question, respiratory and metabolic. If BeCO2 is the same side with pH, so it is respiratory. If HCO3 is the same side with pH, that means it's metabolic. Now BeCO2 is with the same side with pH, both in the acid. So this abnormality, it comes under respiratory acidosis. Respiratory acidosis. Why acidosis? Because the pH comes under acid. BeCO2, it's in the acidic side, and BeCO2 representing a respiratory system. So now we'll come for the third question, which is compensating or not compensating. Actually, compensating or not compensating, this is based on the pH. Means what? Means if your body is or blood is acidic, your body is compensating to make it back to normal. Like for example, if you have higher sides of BaCO2, maybe the body will compensate by increasing the alkalosis, increasing bicarbonate, just to buffer or to overcome the higher levels of CO2. Okay, so if pH is normal, okay, and the others are abnormal, that means this is fully compensated respiratory acidosis. Okay, we have respiratory acidosis now, but what is the pH? pH is acidic, that means it is not fully compensated. But if the pH comes under normal here, this is called fully compensated respiratory acidosis. That means the body was able to regain the pH to normal. Okay, so partially compensated means all parameters are abnormal. If all parameters are abnormal, that means you have partially compensated respiratory acidosis. Okay, partially compensated. So if you have pH and BaCO2 or bicarbonate normal, that means no compensation. Okay, no compensation. If pH is normal with normal BaCO2 or normal bicarbonate, that means no compensation. Because if there is any imbalance, means BaCO2 is high and bicarbonate or bicarbonate is low or high accordingly, but the other one needs to be changed to overcome the other abnormality. So if you have pH is normal with normal BaCO2 or normal bicarbonate, that means no compensation. I hope that you understand my interpretation. And if you have any questions or queries, please write your comments in the video. Thank you so much.